right. Are we ready to go?
Yes.
It's not moving. No.
Yep. 8, 9.
All right.
10
Well, thank you.
seconds.
Okay. Today I have the delight. I'm Carole Baggerly with Grassroots Health, and I have the delight of having Susan Ryan here with me, and she's another one of those fantastic advocates of vitamin D. Hi.
Hi, Carol.
Thanks for coming.
Oh, it's my pleasure.
Okay.
We met, I think, close to 10 years ago, so I've been familiar with all your work.
I believe so.
And it's just great. I think both of us discovered vitamin D.
Tell me about your experience with vitamin D. What did you discover, and what have you been doing?
Well, what happened was about 11 years ago, 12 years ago, I was in my early 50s, and
be careful now, you're giving up your age.
I was in my early 50s and had retired and was looking forward to really enjoying life with my husband.
Mm-hmm.
And although I looked fine and all that on the outside, I wasn't feeling well. So I decided to take it upon myself to start going to continuing medical courses.
Mm-hmm.
And that's what I did, starting out with bioidentical hormones, that kind of thing. And then one gentleman did a presentation on vitamin D. And I thought, wow, vitamin D, it's simple, it's safe, it's effective, it's inexpensive. Hello, what's the matter with this story?
Right.
So I started to, I should back up and say I had my vitamin D checked,
Mm-hmm.
and it was 24.4 nanograms per milliliter.
Mm-hmm.
And even back then, I knew that wasn't very much.
Right.
So I started taking vitamin D and experimenting with different forms of vitamin D. I was getting impatient with myself on getting my levels up, and taking, of course, my doctor tried to put me on prescription vitamin D, and I said, no, that's D2, it's ergocalciferol, we don't want that, and started, I think, educating him. He was very good about it.
Yes.
So I was taking over-the-counter supplements, and then I even tried the liquid supplements,
Mm-hmm.
and thought, well, gee, that's probably going to absorb better, and, it'll up my levels. Well, actually, it really didn't. Where I ended up finding my success point on this is to take capsules that are oil-filled, because vitamin D3 is fat-soluble.
Right.
It just makes sense for the delivery of the D, and that's what I've been taking ever since.
All right.
And I should add, Carol, that I have discovered over my years of researching and going to conferences and just learning, trying to absorb everything, is that to really enjoy a vitamin D3 level, I think you need vitamin K2 and magnesium. So what I did several years ago is I developed a protocol. It's called the Vitamin D Wellness Protocol. And what it entails is starting out with 5,000 milligrams of vitamin D.
International units, I think.
I'm sorry,
Yeah.
thank you, IU of vitamin D. And then after 2 weeks, go to 10 if you're comfortable with the 5. And then take approximately 100 micrograms of vitamin K2. And then again, approximate on magnesium, about 400 milligrams of, I recommend a magnesium glycinate, because glycine is a calming agent, and to take that before bedtime. So what my protocol looks at is take the fat-soluble vitamins right after your breakfast or with your breakfast with some healthy fats, and then you have that D and K working synergistically within you all day. And then before you go to bed, take some magnesium glycinate, and a lot of people say it does sort of calm them down, help them for sleep. And so
well, some really interesting news to feed to you, which I doubt that you know yet. We have always been doing vitamin D testing and reporting on that to end users We've added omega-3 this last year,
Mm-hmm.
and doing that. And within the very near future, we'll be doing K2 and magnesium testing as well.
Oh, that's exciting.
So to me, and with Grassroots Health, one of the key things that we strongly believe in is you got to measure something
Yes.
to see how well you're doing.
Yes.
That's concrete that you can kind of target. So fantastic.
Oh, I'm thrilled. And I
Thank
was thrilled to hear Joanne Manson yesterday
Mm-hmm.
say that her study was going to start looking at that. In fact, I talked to her after her
Good.
presentation
Good.
and just reinforced that's just great. And that I told her about what we were doing.
Tell me a little bit about what you have run into or conclusions you've reached. Our biggest thrust right now is our kind of tagline is moving research into practice now.
Mm-hmm. Mm-hmm.
What have you run into or what conclusions have you reached today that would enable this message and action to get out faster? I mean, how do we change behaviors now?
I'm all with you on that. I'm totally with you. I think I've been able, in my own small way, to do a couple things.
Okay.
One is that I founded back in 2015 a Facebook support group
Okay.
called Vitamin D Wellness.
Oh, good. Okay.
And it's an international group. We have people from all continents except maybe Antarctica. I can't claim we have Antarctica. And then, we've got a great group. We have people pouring in every day.
Okay.
And some of them know absolutely nothing. But they're to the point, I've got a lot of people that will go to their doctor and say, I'm on this protocol. I'm feeling better. This is working for me. So I think it's a lot of word of mouth.
Yes.
And then, as you know, I've written a couple books on vitamin D.
Well, I do know that.
And
Tell us the names of them.
the names are, the first one, and that came out 2013,
Yeah.
is Defend Your Life.
I love it.
And then just 3 months ago, my second vitamin D book came out, Defend Your Life 2. And the focus of that one, Carole, and I think you'll appreciate this, is looking at new life. I start out with, prior to conception, a lot of people do not know that, men and women should have their vitamin D levels up if they know they're trying to have a baby. And then what goes on in pregnancy.
Well, before you go there, just let's go on and remind people that actually vitamin D affects the fertility of the male and the woman.
Exactly.
Both of them.
Exactly.
So it's a very serious issue then.
It is. And I've even been in some of the fertility groups and so forth, trying to spread the word there.
Okay.
And you can tell most people have no idea.
Okay.
Absolutely. Ladies will write in and say, I've had 3 miscarriages in a row, and I just, and well, have you had your vitamin D check? What's that? And then we get, and then I invite them into my other group.
Yes.
So this new book is the way one lady described it. She said, my first book was like an appetizer, and the second book is the main course.
Fantastic.
But that main course includes a core part that is about fertility, pregnancy and pregnancy complications and how to diminish the risk of them, and then neonatal, lactation, that kind of thing.
I want to come back to another point here about the preconception and the research that's already been done, not with vitamin D in particular, but there's a subject or area, it's called the Barker hypothesis, and Dr. Robert Haney wrote an article about this. But I went to a presentation once by Dr. Kent Thornburg, who actually works with the Barker hypothesis, and they have data that shows you can investigate the placenta and predict whether or not the child who had that placenta will have a heart attack at the age of 50.
Wow.
I mean, that's how important it is.
Yes, and I can believe that.
Isn't that beautiful?
as you know, the other day we had that fantastic presentation on the placenta and vitamin D, which I just found totally relevant and really glad to see that the research is going in that direction. But that is amazing. It's
We're getting
so
ready
important.
to initiate some projects in pediatric centers around the country where the total population in those offices, both the mothers of existing children and the children, will get their vitamin D levels up, and then of course many of those women will then possibly get pregnant, and they will already have their D levels up. So we're very excited to get this going.
That's just
Isn't
wonderful.
it great?
It is
it's
great.
Like, there are so many opportunities.
It is great.
Out there.
Yeah, and I'm all about improving quality of life. That's something, when I first discovered vitamin D, it's like, gee, I feel so much better now. I think other people will. And it
What
just,
did you notice first?
less fatigue, less muscle aches.
Interesting. Okay.
I just was feeling old for my age in a way, would be a way to describe it.
Okay.
And I just started to kind of feel like I was getting my act back together, that I was
How long
feeling
did it take
myself.
before you felt a difference?
I'd say at least 6 months.
Okay.
You know, you felt some in the beginning, but a good, it was a good 6 months, and then I was just like a different person.
That's great.
I can't imagine my life without vitamin D3.
If you know your serum level, would you mind sharing it with?
I would not at all. My winter vitamin D, and for anyone who's watching, listening, winter vitamin D means getting your vitamin D level checked after the winter months.
Sure.
Because we're not outdoors and not out in the sun as much. That was 95 nanograms per milliliter.
Okay.
That's low for me. I really try to aim for 100.
Why?
Because labs have for years had 100 nanograms per milliliter as the top end of the reference range. And I know, there's many fora and all that are discussing what is the right number.
Sure.
My personal opinion is we should be aiming for 100 because it's just, I call it optimal, that's, something to shoot for. I actually have been a fair amount higher than that and felt even better.
Okay.
But around 100 is fine, and you may be interested to know that there are some labs that have raised the reference ranges to 150.
Well, the reference ranges, are really just what they see in the lab. They really aren't recommendations.
Yeah.
So that means that some of those bigger labs that have more people with higher levels are getting those levels, and that's great.
Yeah.
That's great.
Yeah.
That's great. The addition of the omegas and vitamin K and magnesium, all of these nutrients and how they work together are what we're working on very much now, and they do all work together. So that's also very, very, very exciting.
It is because they're all cofactors. Yeah. And both of my D3 books do address the cofactors. I do even more so in the most recent one. Even mentioning boron and zinc, for example.
Oh, there's everything, isn't there? Isn't there? The minute you get into nutrients, you recognize it really is a plural word.
It really isn't. That's why vitamin D really shouldn't be a standalone.
Please tell the people that are going to be listening to this, what's the first step they should take today, and what should they do tomorrow to really, really get their life together?
That's a good question.
With nutrients. I mean, there are
nutrients. With nutrients. Well, first of all, I would look at what I'm eating and analyze that and, try to eat cleaner. But I would explore my vitamin D level really quickly. And that's, as you know, very easy to do, that there are at-home kits you even provide. A kit, there are other
Let's mention
organizations.
this again. We run a big project called Vitamin D Action, and we're located at grassrootshealth.net. So
That's right.
That's my plug.
That's right. So it's easy now. In fact, I work with a lot of people in the UK, and a few years ago, the NHS, the National Health Service, really didn't, it's like vitamin D test, what do you want that for? And they're coming around and doing that now. So it's wonderful. I see a big improvement in the UK. Just that the word is really getting around. And but back to your question, get that vitamin D tested, or really you can pretty much assume you're deficient.
Yes.
And start taking it.
Yes.
That it's readily available at grocery stores, retail stores, online.
Yes.
It's inexpensive when you look at what it costs per day. It's in many cases pennies.
Well, thank you. I appreciate the opportunity to talk with you and to share the word that you have shared so effectively over these years. And we'll talk to you more.
Sounds good.
Thanks for coming today.
Thank you very much, Carol.
All right. Thank you. I think that was